Good morning, everyone. I'm Scott Micklin, along with Megan Cullip.
Hey, good morning, everybody.
Thank you for being here. This is our first COVID-19 local information program from KSJE.
Yes.
And we are here to provide local information to our audiences on Facebook and YouTube about the community's response to what's been going on. And I know you've been watching things happening and really being amazed by some of the more positive stories that we're seeing in the community, which is great to see. And we want to share some other local information as well.
Yes, tons of positive stuff, actually. I feel like this is redeeming social media.
Well, we're going to try. We're going to try. But we also have some guests who are going to be calling in from time to time. And this is going to be a daily show, everyone, Monday through Thursday, 9 a.m. Every morning, Monday through Thursday, here from KSJE, as we share whatever's going on that particular day with our audiences. That's the plan.
That is the plan.
Megan's committed to being here.
I am committed to being here, yes.
We appreciate that.
Thank you.
So there you go. We do have a caller, so I want to go to the phones and welcome them to the program. Good morning. You're on KSJE. Who is calling? I think this is someone from the hospital.
Hey, Scott. Good morning. This is Jeff Bourgeois and Dr. Bob Underwood, our Chief Medical Officer.
Good morning. You're both together, which is wonderful. Appreciate you both calling in, and thank you very much from San Juan Regional Medical Center. And, of course, we saw over the weekend the first positive case from a test at the hospital. And so maybe, Jeff or Dr. Underwood, if you could take us maybe through how that happened. The test was done on Wednesday, and then the results were released on Saturday?
That's correct, Scott. It was an individual who came through our external assessment area this past Wednesday. What we know is that public health officials have deemed it to be a travel-related exposure, and that individual is not hospitalized. At home on self-isolation protocol.
Very good. And this is part of why you are doing these external assessments. Is that correct?
Right. We want to help those who are truly symptomatic identify if they've been exposed, and then they can take appropriate precaution for themselves and their family.
And again, I know the hospital has been sending out updated information, Jeff Bourgeois and Dr. Underwood, about these external assessment and the areas and the times that you'll be doing this. And again, you've got 3 times set up, I believe, this week again, correct?
That's correct. On today, it'll run from 10 a.m. till 2 p.m. And the same times on Wednesday and Friday of this week.
And just for folks who are listening and watching us, the area that we're talking about, it is outside of the hospital. It's kind of away from the emergency department, kind of along Pinion Street there along the back side of the hospital, if you would, right?
Correct, south side of the hospital.
There it is. And so, again, and you're asking for folks to come through. It's kind of a drive-through situation, right?
That's correct. And, Scott, we're really only encouraging those that are truly symptomatic to come through. We have to preserve our resources, which include the collection kits for people who screen in to be tested, as well as preserve the personal protective equipment that our staff is wearing in that circumstance out there at the external assessment area.
Right, certainly. I will let Megan Cullip join the conversation here. I didn't mean to ask all the questions, Megan. But
well, I do have one important question,
yes,
which is, how would I know if I was symptomatic? What are those symptoms?
So primarily what we're looking for is fever in addition to body ache, cough, and shortness of breath. Those are the standard ones that if you go to the Department of Health website, if you go to the CDC website, those are the primary symptoms that we're looking for.
Great.
Gotcha. There you go. And again, those will be 3 times this week. You've got that open for folks in the community, right?
Correct.
Very good. Well, gentlemen, I appreciate you coming in. Is there anything else that we should be sharing with the audience about how the hospital is responding? I imagine for all of you, this is something that's kind of uncharted territory, right? I know you train for mass events, but this is a little bit different, is it not?
Yeah, no doubt. Scott, I'd just like to ask the community to support their caregivers here at San Juan Regional and our entire community by just paying attention to all the warnings and advice that are out there on any website related to COVID-19 about appropriate social distancing and and everything that goes along with washing your hands and covering your cough and sneeze. I do want to let people know that it does take oftentimes 3 to 7 days for us to get a result back. The 4 labs in Albuquerque that today are able to result these tests for us are running at their capacity as well. We do not intend to frustrate anybody, nor do they, with the amount of time that it's taken to turn a test result around. So be patient, be calm. If you are at all concerned, self-isolate, practice all the advice that's out there. And Dr. Underwood did have, really, let me anticipate one more question. So, Dr.
All right.
Underwood, if we're telling people to stay home, at what point should they call their doctor or seek further care?
The primary thing that we're looking at to stop self-isolating is really that shortness of breath component. That would be a point at which we think that you ought to call your primary care physician and ask further guidance. Otherwise, with the milder symptoms, staying in home and self-isolating is really the primary choice. In the end, it's a virus. There is no proven treatment for it. There's no vaccination for it. And so supportive care, self-isolation, washing your hands a lot, using sanitizer on your hands, all of those are still strongly recommended.
Makes sense. And of course, as you both have mentioned, though, these test results do take a couple of days. It's possible if you were positive and you're not isolating, you could be unknowingly maybe infecting others around you. And that's why this social distancing and self-quarantine is so very important these days, correct?
That's exactly right. We like to say prepared, not panic. We strongly urge everyone to remain calm, but at the same time, take all the advice extremely seriously. We need to protect ourselves and protect those around us. So don't underestimate the importance of following all the advice that's out there around social distancing, hand washing, etc.
And further to your point, Scott, is that especially younger people may have only minimal symptoms, yet they're still shedding the virus and potentially passing it on to others who may be more vulnerable. You've all read the news that it's the patients that have significant other medical problems that may be at risk, and the elderly. Younger people are often not as symptomatic, and they may be shedding the virus and conferring it to other people unwittingly, and that's really where social distancing comes in, to make sure that we're not interacting and sharing the virus with people when we don't even know we have it.
Very true. Well, gentlemen, I appreciate you being with us. We're opening the phone lines to our viewers who might want to call in with a question that we haven't asked either, and that is 566-3909. 566-390.9, everyone, if you would like to call in, or if you're watching our Facebook live stream, you can ask a question on Facebook, and it should pop up here in the studio, and we should be able to answer that. But again, gentlemen, if you would certainly extend all of our gratitude to your staff and the folks that are working at the front lines there at Samuel Regional Medical Center. We certainly appreciate all the work that they're doing. I imagine it is a lot of uncharted territory, as I've already said.
Certainly is. Scott, can I put a plug in for the blood drive that will be held at the hospital's main parking lot this Friday?
Yes.
This Thursday.
Thursday blood drive. Yes, because we've heard that there's a shortage, so thank you.
Yeah. 6 a.m. to 6 p.m. We'll have a mobile unit out in front of the hospital in the main parking lot. We ask that donors schedule appointments online by going to www.bloodhero.com. Then clicking on locate a blood drive, you can search by date and zip code, and that will allow, and then the donor can answer a few questions that will help them screen in for eligibility to donate blood, and then that way we can manage the crowd at the mobile unit. As within the unit itself, they'll be practicing social distancing, so limiting the number of donors that can be in their mobile unit at any one given time.
That's great. And again, that's going to be on Thursday beginning at 6 a.m., you said?
6 a.m. through 6 p.m. Yes, sir. Thursday, March 26th.
Okay. All right, very good. And as far as other things at the hospital go, gentlemen, I mean, are you still able to do elective surgeries or some other things or things along that line, or are those kind of on a case-by-case basis?
That's actually right. It's on a case-by-case basis. We have put out a policy with the physicians all being united behind this of stopping elective, and of course there's a lot of caveats in what is really elective procedures to be done at the facility. Anything that can be postponed without significant harm to the patient will be. So we have a review team of providers that will look at cases that are being proposed to be done to look at will it be a delay in a diagnosis, or is there a pain element that it needs to have a procedure done right away, or is there risk of life or limb to the patient if they don't have the procedure done. But otherwise, elective procedures, simple diagnostic screenings, for example, those will be postponed until we get to the other side.
I have one question regarding that. Is that primarily to save medical equipment, or is that because there's a higher risk of catching something?
All of the above are true. Of course, preserving our protective equipment, our PPE is what we call it, is one of the things that we've heard across the country. We're not in that position, but we don't want to get there right now.
Got it.
So that was one of the first considerations. But yes, there will, like anywhere else, we're trying to avoid crowds and congregating of people into a common area. And although we have good, what we call ingress and egress from our surgical area, we still would like to decrease that contact of individuals with the possibility of conferring the disease to each other.
Very good. And I know there's something else we're going to talk about this morning, Megan Cullip, and that is some folks in the community are trying to maybe put together some protective masks and things like that may or may not be hospital quality. But while we have folks from the hospital on the line with us, is there anything that folks could be helping to provide to the hospital that they can help with?
Well, right now we have one local company that has a bank of 3D printers. They are exploring their ability to make face shields for us.
Okay.
There's been some successes in pockets around the country where that's happened with the 3D printing technology. I'm working with a board member who is kind of coordinating communications to a large community group who's interested in making masks for us. And we are still pending a validation of what is the best material to use. There's limited research on this, but there is some out there. We want to make sure that if our great community steps up to support us that way, we can have their efforts be of the greatest value. So we're almost at the point where we can turn that group loose to start making masks for us. But in the meantime, know that we're taking steps internally to preserve what we have or conserve what we have, and we have an emergency supply through our disaster preparedness materials, and so we're in no imminent danger of running out of personal protective equipment. We are just trying to prevent getting in that position.
Sure. Well, that's good to know, and we're going to be doing this program Monday through Thursday, so it sounds like maybe you'll call us back when you have an update for us on that question.
You bet, Scott. Let us know, and we'll work with Roberta, of course. And
of course.
We have something important to share. We appreciate your support in helping us spread the word.
Well, it's an important thing, and we're all in this together, as we have said time and time again, so we're glad to be able to do this. And so I thank you all for taking time out of your day to join us this morning, gentlemen. Thank you.
Thank you.
Thank you, Scott. The community coming together from our perspective has been really great, so thank you.
You bet. You bet. You're very welcome. And we'll talk to you again soon, both of you. Thank you very much, gentlemen.
Take care. Thank you, guys.
You bet. From San Juan Regional Medical Center, that is CEO Jeff Bourgeois and their Chief Medical Officer, Dr. Bob Underwood. And again, lots going on. The hospital certainly is.
How much do you love having like official people answer these questions for us?
I love that.
know.
I mean, it's from the source.
Straight to the source.
That's what we do here, right?
Yes,
So
yes.
there you go. But we talked a little bit about masks, and I know
We did.
Folks are maybe wanting to create some of these things, and if they can't be maybe used at the hospital in this capacity, perhaps they could be used in other places, like maybe senior citizen homes or things along that line, where it's maybe not quite so medically necessary to have a specific type of mask.
Right. Yeah.
right?
I mean, I would think just wait for confirmation on what is helpful and what is not helpful.
Right.
Because I know nothing about what fabric works, what
Right.
the
You and me both.
what the parameters are on what makes a good mask and what doesn't help at all. And so sounds like that those guys over there will have some sort of helpful answer. It's probably not going to be of the same quality as the usual protective equipment they get, but I'm sure that if we get in a bind and it's even remotely helpful, that they'll take it. And so I think that just like in general right now, the specific ways to help out are we're kind of in a gray area, I think, really as a community. What makes most sense,
I think part of this is the blood drive, for
yeah,
sure. We can help with that.
bloodhero.com. And I have O negative, so I have like liquid gold running through me
There,
right
you
now.
should be signed up.
I should.
Already.
I
That's
should
right.
be signed
That's
up
true.
already. Yeah.
I also want to bring Devin Neely, who was with me on my program earlier this morning, who is still with us, and I appreciate that very much, from San Juan County, to talk maybe a little bit about Megan's question. Devin?
Yeah, that's correct. We are working, the Office of Emergency Management is working with San Juan College and the City of Farmington on creating a hotline for folks to call if they want to volunteer, if they want to be involved in some way. What we need first is we need organizations that can accept volunteers and use some help or work with folks that are quarantined or whatever that is. We need to know what the possibilities are first. And so if you're ready to take a phone number, you can call 566-4210 Monday through Friday between 8 and 5 and give us your organization's current needs and a contact name within your organization who will be able to provide ongoing updates. We'll need an email and a phone number.
Okay.
And then our friends at the San Juan United Way at the helpline are going to be able to connect folks that want to help with people who need the help. So, the hotline is not fully operational right now because we don't have all the information, but the 211 San Juan United Way hotline is going to be where to call if you want to get involved, and the 566-4210 is the volunteer center here at San Juan College that is facilitating that. And so we at the Office of Emergency Management in San Juan County really appreciate the partnership of San Juan College and the City of Farmington to make this happen.
Right. Very good. And United Way.
Yeah,
Sounds
exactly.
like too. So that's great.
Couple of comments on that.
Yes.
I did call Echo Food Bank directly last week, and they are in need of volunteers,
Yep.
mostly to put together boxes because they're doing drive-through food pickups. And that is a huge facility. They didn't put anybody near each other, so they kept to that rule. And
So they actually have a very specific COVID-19 volunteer page.
Yes.
That you can go through to get vetted to volunteer
Yes.
down there, and they have the guidelines in place. They are in desperate need
Yes.
of help, and I believe starting at 10 o'clock this morning is when they are asking for folks to come down there. That information is on Facebook as well as the Echo page. There's so many places in our community. Our city manager in Farmington, Rob Mays, gave blood last week.
He did?
And
O
showered-
negative, or
I don't know
I mean-
what kind of blood. I don't know.
I
didn't
know. But he
ask.
was donating.
we got to get that
And he was
information.
and he was live. He did a live video
Yep.
from his donation.
Oh,
So when
wow.
you go in, we expect a video from you.
That gets. I'm like queasy thinking about that.
Okay.
Yeah, you don't. do
I'm just going to
needles?
close. Well, I don't.
all
Anyway.
right. Okay.
I mean, I'll do it. I'll suck
All
it
right.
up. I'll do it.
Very good. But important to say, if you're looking for something to do,
Absolutely.
Echo Food Bank may be able to help you in a volunteer capacity, and
Yep.
you could sign up and help
Yeah.
others.
I mean,
Sure.
I also think going to the source like that is one option while we wait in the interim for these things to be.
Right.
Yeah.
Well, and so Echo Food Bank giving blood, and the Medical Reserve Corps are all very important right now. If you're not familiar with the Medical Reserve Corps, it's facilitated through San Juan Regional Medical Center. And if you have any medical background or not, they have specific tasks for specific people. Should we have necessity to get some more folks into the hospital, if you work through the Medical Reserve Corps, you can get pre-credentialed. They already know what you're capable of. The Medical Reserve Corps is extremely important if you have any medical background, and even if you don't, if that's something that you're interested in helping, they'll need intake folks, they'll need all sorts of people involved should it rise to that level. And so being pre-registered with the Medical Reserve Corps is very important. Echo Food Bank, give blood. And there is something else, and now I can't think of it, but I'll find it in just a sec.
He will, and we'll go back to you in just a second. I also want to show everyone the website at ksje.com. We've been trying to compile the local information on our website that can then take you to some of the other sites that we're talking about, like Echo Food Bank and places like that. And so I just wanted to show this to you under news. We have a special COVID-19 coronavirus tab, and that takes you to this page, which shows you how many cases we have in our state at the moment, some links to the state health department, and then if you keep scrolling, there's a video about kind of how to stop the spread of germs, and then we get to the actual updated news stories. And of course, the latest one that just came out from the city of Farmington was changes to the Red Apple Transit system, the bus system in Farmington, and the dial-a-ride system. The city announced some changes to that just late yesterday, and so we're sharing that on the website as well. Then the story, of course, about the first positive case. And Devin, we're having a message here about the animal shelter. Is that what you're thinking of?
Yeah, that's not what I was thinking of. I was thinking of the American Red Cross is also pre-registering volunteers through the local chapter. And Liesl Dees is reminding me the animal shelter needs folks to walk dogs. And
they do. That's true these days.
Very intentional about how many dogs an hour and how many people are going to be there at the same time. But if you want to take a dog for a walk, practice some social distancing down in Berg Park, the Farmington Animal Shelter is a good way to do that. So
right, and they have. I've seen. I don't know why, but I've seen like 10,000 articles about how your dog is not in danger of catching the virus. So there you go.
And you can't catch it from
Dogs
your dog.
Are safe.
So there you go. That's true. I think that's a great idea. But that's wonderful, and the Red Cross as well. Another great opportunity. But again, showing you our website, we also have information from the Navajo Nation, from Navajo President Jonathan Nez about the number of cases there. And as we keep scrolling, we just keep adding them on as we get them in, everyone. Central Consolidated Schools and San Juan County encouraging online and appointments. Again, that was a Devon initiative to update everyone on if you need help from anyone at San Juan County government, that you can make an appointment and talk to the people that you need. There is the San Juan Regional Medical Center external assessment story that we talked about earlier with our guests from the hospital about their 3 sessions this week. Mexico Gas Company suspending service disconnects during this time, and some other information about facility closures here in the city of Farmington, and on and on and on. So that is kind of what we're showing you on our website. But again, it's a great, hopefully one-stop place to get lots of important local information, lots of locally sourced information that you can rely on and use to make decisions for you and your family. So that's the important
Well, and
thing.
I also noticing as we scroll through, which I think is an important comment because we focus so much about elderly folk, immunosuppressed folk, but there's a lot of young people on that list. So I just, increasingly, I think they're discovering how many young people are getting sick. And so, I know this is supposed to be a positive show, but just remember, listeners, nobody's immune.
That's true.
Yeah.
That's very true. We do have another caller, and let me go to the phone lines and welcome them to our program. Good morning. This is KSJE.
Hey, good morning, Scott. It's Mike Mestis, the emergency manager for San Juan County.
That's who I thought was calling in, Mike. Thank you for doing that, Mike Mestis from the San Juan County Office of Emergency Management, and we appreciate your time this morning as well. And Mike, I understand that you are about to get a little bit busier because you're going to try to be disseminating a lot of this information that we're seeing from different sources through your office to moving forward, correct?
Yes, Scott, and thanks again for having me on, and I apologize for not being in studio. As you stated, we're real busy these days. I think we're going on day 18 of this, trying to keep San Juan County ahead of the curve, so to speak.
Understandable, Mike.
Yes, Go ahead, Scott.
It's understandable. We're glad you're with us on the phone.
Okay, so yeah, right now, this last few weeks, we were in the planning prevention phase, but as you know, we received a positive test on Saturday. So from there, we want to be totally transparent with the community that we have a case in our community, but life goes on. We need to continue day-to-day activities, more vigilant at this point, knowing that it's in our county.
True. Very true, Mike. And again, I don't know if it was anything surprising that we would soon get a positive case, and we'll probably see more before this is all over. Don't you agree?
Yeah, I totally agree, and what history is showing us with New York and Italy and everywhere else around the country, that it's going to get a little more worse before it gets better. But we're in a unique situation here. We're kind of isolated. People are taking this serious. Wherever I go around town, I'm seeing the fast food restaurants shut down, doing drive-ups. People with rubber gloves on. Stopped by McDonald's for a cup of coffee this morning. The guy at the window said they're required to wash their hands every 15 minutes and rotate stations. I like seeing things like that going on in our community, Scott.
Yeah, no, very much so. That's wonderful. Megan Cullip's also here, Mike, and if you have a question for Mike Mestis.
I don't, but
okay.
But I will say that I too am impressed with the fast food workers. I feel like they're like another unsung hero group. I actually was just talking to Devin about a little creative tactic to get some FaceTime that I did this weekend, which was to have a friend follow me, individual vehicles, do a drive-through run, park in the parking lot, roll the window down, like cops do, and we were able to share lunch together while keeping appropriate distance. So there you go.
Well, there
you go, listeners. That's free knowledge.
There you are, Megan. Thank you very much. And go ahead, Mike.
I just want to say thank you to our community in general because, for instance, Dr. Pendergrass at San Juan College, she's donated because the nursing program, school obviously is closed right now, the nursing program, the dental program, she's donated the personal protective equipment that they use for the program to our home health, our hospice, our nursing homes, the emergency room that was running low. And we're able to distribute that PPE out to the community so that they're a few weeks ahead of the game. Just on Saturday, they had the home builders said they want to do a drive and get PPE, coveralls, masks, dust masks, just things that some of the healthcare workers can use. So totally, our community just steps up, just like we did during Gold King Mine. Everybody in the state asked, how come you guys have such a successful program up in San Juan County? And it's because of our community, people wanting to step up. Case in point, Three Rivers generating the hand sanitizer so it can be used.
Yeah, I'm glad you mentioned that, Mike Mestis, because they definitely deserve a shout-out that the folks at Three Rivers Brewery is now using some of their equipment to manufacture hand sanitizer and then donating that to local first responders, correct?
That's correct. I guess the sheriff already received some. The Farmington Fire Department's received some. So yeah, we're working totally with them to try to have that manufactured so that we can distribute that to some of the nursing homes in the hospital. A lady with a seamstress group is making covers for the N95 masks so that they can take them home and wash them at the end of the day, and they can preserve their N95 masks that they're limited to. So just everybody in our community wanting to step up. It's great to live in San Juan County, Scott.
It definitely is. Well, you're preaching to the choir, Mike Mestis, but I agree with you. So thank you for joining us, Mike. And we're going to be doing the show every morning, Monday through Thursday. So when there's new things to update, I hope you'll call us back.
I will. Let me try and clear up some of the misconceptions before I go.
Yes, please.
People are calling and saying, how come the shiprock cases aren't being counted for San Juan County in the NewMexicoHealth.org category? Keep in mind they're doing screening at IHS and Shiprock, but none of those patients are being kept in that hospital or kept in our county. They're being returned home in that case to the Kayenta area. So those are counted as Arizona cases.
Correct.
So,
that's a good distinction to make.
Exactly, and we really don't know how many of those cases were even screened. I know the Navajo Nation is putting out, I think this morning, 24. But all that stuff is HIPAA laws, and we don't know how many are screened there. But I assure you, I've spoken with the emergency manager out there, the healthcare nurses. They're not bringing those patients, just like our hospital. They wouldn't be bringing those patients in to their hospital unless they're critical. So
very true.
They're all being isolation.
We do have a map on our website, Mike Mestis, about the cases on the Navajo Reservation, including the one case in Farmington, which is off the reservation, of course, but there's a couple in McKinley County, but the rest, as you've rightly mentioned, are all in northeast Arizona and kind of clustered around the Kayenta area by looking at that map. So we want to be clear about that.
That's correct. Yeah, and people have good reason to be alarmed and to be cautious. So the heightened awareness right now is what we're preaching, and continue with the hand washing and the isolation. I know the town seemed really busy this weekend. Of course, people try to come in and buy products that they can't get in their local area. But, yeah, for the most part, as we were speaking before, people are taking it serious.
That's good. And, of course, the whole idea is to kind of flatten that curve. We've heard that over and over again, and that's the idea. If we kind of do this sooner than later, hopefully we don't have to do this for as long as maybe other places are having to isolate and distance and things along that line. And that's the whole idea, correct? So we don't overwhelm our healthcare professionals, our hospitals, and our emergency workers, those types of things, right?
Yeah, that is correct. By limiting the spread, then we limit the possibilities that we'll go into major emergencies in our future. So, but keep in mind, we're prepared. We have our emergency operation center stood up. We have briefings with our community leaders weekly. Our emergency management EOC table is briefed daily, and we're staying ahead. Case in point, February 28th, I knew this was coming. I convened meeting with our leaders and said we need to start preparing for it. And not to brag, but we're 2-3 weeks ahead of what is going on in the state of New Mexico. So we're staying ahead of it.
Well, we appreciate your leadership, Mike Mestis, and thank you for sharing the information with us this morning. And hopefully we'll check back with you later on this week or in the next couple of days.
Be more than happy to call in and give updates, Scott. So thank you very much for having me on.
You're welcome. Thank you, Mike. Take care.
Thank you.
That's Mike Mestis, everyone, from San Juan County Office of Emergency Management. Our guest here, this is our COVID-19 Community Information Program. I'm Scott Micklin along with Megan Cullup, and we are sitting here in our studios with social distancing.
Totally.
Yeah. Stay over there.
Yeah.
And
Stay over there. Wipe down the hard surfaces. Yeah, we're good.
We are sharing information with our community, which I think is an important thing, and we're glad to be able to do that this morning and every day this week, Monday through Thursday, 9 o'clock.
Yeah, we're going to try to met out and ration the news so that we have something for you every day.
Right. That's true.
Yeah.
And we want to hear from you, too. Again, we've got the numbers on the screen if you want to give us a Facebook comment or call in and tell us what's working, maybe if you're having to educate the kids at home.
Yeah, I was going to say,
How's that
it'd
going?
be really, well,
right?
Farmington, shout out to Farmington Municipal Schools. The teachers have already sent out some helpful schoolwork to be done. So don't worry, you don't have to, come up with all of your lessons on your own. At least all I could speak to is that school district.
I've seen tons of sources on social media, too, that seem pretty...
It's like Coronavirus Academy out there.
Right,
yes.
right.
Well, and it would be interesting to, I was talking to somebody yesterday about filling all of this time. We all find ourselves, a lot of us are working from home and all that, but we're also, again, isolated for the most part, and filling all the time. And I realized how many people lack hobbies, right? So that would be an interesting call-in. How are you managing your time at home away from various activities you used to be involved in? What are some fun hobbies that people are doing?
I think all of us are going to have awesome yards this
Well,
summer
and,
because we're all spending
back to-
time out in the yards this spring,
Right.
perhaps.
Chia pets, pet rocks.
Okay.
I'm just kidding.
There's that.
Yeah. I'm not. I'd have to be pretty desperate to go back into that. But
But it's an option.
it is an
How's
option,
that?
listeners. Yeah.
There you are. But that's very true. Well, is there anything else we need to share this morning from what we know with our listeners? Devin Ely?
I have three things, if
Devin
I may,
has
Scott.
three things.
Three
Okay.
things. Okay,
All right.
first and foremost,
Yes, sir.
Our friends over the San Juan County Communications Authority put out some information on Facebook, and they're asking that people don't call to ask questions about coronavirus. Leave those
yes.
lines open for true emergencies, because if our emergency lines are tied up, then there's not a whole lot that we can do for in the case of a true emergency. So please don't call for questions about coronavirus, and please don't call for questions about where to get tested. If it is a true emergency, please call 911, but reserve those lines. The second thing is, over on the McGee Park Facebook page, we have put up a ton of resources for families. This week, with school back in session, as you mentioned, you're going to have some stuff to the school districts already have stuff out to teachers, or to families rather, and students, and so I think there will be less need for that kind of stuff, but there is a lot on there. There's some really fun things. There's webcams at the San Diego Zoo. You can see the otters, and sometimes you just need that moment of zen.
Yeah, did you see the penguins taking a tour of their own aquarium?
Yep.
That was awesome.
I thought that was very
Yeah.
cool.
Yeah.
So that's the third thing. And the third
Okay.
thing is, and I know that you guys are probably getting to this, but I have to say, everybody just breathe. The key here is, if you are feeling overwhelmed and you need to unplug from the news for a little while, do it. Absolutely do it. Be aware of your own mental state, and if you are overwhelmed, just stop. Just turn off Facebook, turn off the TV, go for a run, read a book, do whatever I've been seeing a lot of people are baking right now.
Yeah, that's not my preferred quarantine activity, but
for others, it could be.
But it is so important
Good advice.
that everyone looks at their own mental health and those around them. And if you need to remind somebody that it's time to unplug, they may bite your head off, but eventually they're going to thank you for that reminder. I hope that you both are maintaining your own mental health. I slept till 11 o'clock on Saturday morning because I needed it. And I hope that everybody takes that to heart, that if you need it, take that break.
Good point. Very true. Before we go, though, there are a couple other resources I do want to share, and we have a link, again, from the KSJE.com website to the state's website, which is sharing some important numbers, and you may not be able to see these numbers on the screen, everyone, these phone numbers, but there is the coronavirus hotline in New Mexico, which is 855-600-3453, non-health related COVID-19 questions, 833-551-0518. There's a senior food hotline also established in our state at 1-800-432-2080, and there's also an FAQ about COVID-19. But again, that is the State New Mexico Department of Health page, which we have linked from our site. And so again, just providing that useful information. And again, if you're on social media, please make sure you're sharing things that are well-sourced and accurate and not misleading.
Well, yeah, and I would just go so far as to say, unless it's from the CDC, the World Health Organization, or the State Department, State Department, just don't share it. I mean, these are the only experts we have. I mean, KSJE is providing a running list. Everything's right in the same page, and that's really what we have to offer, is a consolidated information source, including very specific local news sources. But when you're talking about what the recommendations are, really nobody else matters but those three organizations, because those are the experts.
They really are. They're credible places.
They're the only
and
credible
so
places, yeah.
We want to make sure. And again, when we put a story up on our website, we are linking to the original source, whether it's San Juan County or the city of Farmington, state of New Mexico, whatever the case may be. We link to that so you can kind of see where we're getting our information from.
Right, all consolidated. Yeah.
Exactly. So, very good. Devin Neely, anything else popping into your head, your phone, or anything?
I mean, not like anything else popping in your head. Let's put some very specific
yes,
parameters
but we appreciate
around
you being
that.
here.
Well, thank you for having me, and as Mike said, we'll certainly be in touch this week. We'll make sure that we have information to you folks when we have new to bring you, and we'll do our best to keep you folks involved.
All right.
and informed.
Very good. Well, Devin, we appreciate all the work you're doing, too. I know
Thanks for having us.
sleeping until 11 o'clock, but you were probably on the job at 11:01, so I understand how that
Pretty
goes.
much. And I, as I look in the camera here, I think it's about time for me to shave too. So
Well,
Yes,
I noticed Chief Heavy
Yes, I was
shaved
going to
his
say
mustache
the
this morning.
chief shaved
Yeah.
his mustache.
Really?
All the police officers and such are shaving to fit. What was it to fit protective
Fit-
gear?
yeah,
If
'cause
they have
Over-
to, yeah.
yeah.
Yeah, if they have to put
So-
on an N95 mask,
Right.
it's classified as a respirator,
see.
actually. And
You
so
need
they
that
have to have a
seal.
seal around their face. And so no goatees, no mustaches, no beards.
It's time. Maybe I should shave. Just kidding.
I wasn't going to say it.
All right, then. I
Scott's-
think on that note,
I think we're going to wrap this
it's
up.
time to go, everyone. But we appreciate you joining us, audience. Thank you for being here. And again, if you felt this program was helpful and had some good information, please share it to your social network circles, because that's the only way we can get out this local information. This is an online program, and we're working with maybe some other radio stations to get it on the radio later on today, but this is where it lives at the moment on Facebook and YouTube. And we'll be back tomorrow morning at 9.
Tomorrow morning.
Okay.
Reason to get up.
I'll be here. You'll be here.
I'll be here.
Okay.
We're good.
All right. Very good. Megan, thanks for being here.
Thank you.
Appreciate it very much. Megan Cullup, on behalf of her, I'm Scott Micklin. Thank you for joining us, everyone. Stay healthy, and we'll talk to you again tomorrow morning here from KSJE.